Hello students, my name is Preeti, working as an assistant professor in School of Pharmacy, BBD University, and today's topic is General Principles of Treatment of Poisoning. So first of all, we must know about poison, right? Poison can be defined as any liquid, gas or solid substance ingested through oral, topical or inhalational route that has the potential to interfere with the life processes of body organs of an organism. So we may say that any drug which are used to treat any disease, it may cause toxic effect when its dose is increases. So we can also say that all the drugs are poison if their dose is increases. So a poisoning is a serious medical emergency occurs when a toxic substance enters the body, interfering with life processes and causing harm to organs and tissues. This can happen through ingestion, inhalation or skin absorption. The effects of poisoning can vary widely depending on the type and amount of poison, the individual's age, health and how the poison entered the body. That means the route of administration of that particular drug or poison. So what are the goals of poisoning prevention and treatment? We may minimize or may prevent toxic effect of any drug by maintaining vital functions, by minimizing poison concentration, by minimizing its poisonous effect, and last one is by enhancing the elimination rate of any poison or any toxic substances. So here are some antidotes that are used in the treatment of poisoning. First of all, first one is acetylcysteine. It is used in acetaminophen overdosing and it is worked by replenishes glutathione, a liver enzyme which is essential for detoxification. Second is naloxone. It is used in opioid overdosing. It works by blocking opioid receptor and reversing the effects of opioids. Third one is flumazenil. It is used in benzodiazepine overdosing and it works by blocking benzodiazepine receptors and reversing sedative effects. Last one is atropine. It is used in organophosphate poisoning. It works by blocking acetylcholine receptor, reversing the effects of organophosphate poisoning. So how can we prevent poisoning? First of all, by using safe storage. Second one is by proper labeling on that particular drug. Third one is by educate and aware children and adults of our surrounding. Last one is be ready for emergency preparedness, or we must prepare for any emergency condition. So how can any drug may absorb into our bloodstream? First one is ingestion. The poison enters the body through the mouth, traveling through the GIT where they can be absorbed into the bloodstream. Second is inhalation. Poison can be inhaled as vapor, gases or dust particles entering the body through the lungs and entering the bloodstream. Third is dermal absorption. Poisons can be penetrate the skin and enter the bloodstream, particularly if the skin is broken or if the poison is highly concentrated. Last is injection. Poisons can be injected directly into the bloodstream, bypassing the GIT and achieving rapid absorption. When any poison directly go through our bloodstream, it is highly toxic or highly dangerous, may cause lethal effect or death. So how can we prevent the absorption of poison? Here are some points. First is emesis. Inducing vomiting can help remove ingested poisons from the stomach before they are absorbed. This method is typically reserved for specific situations and requires careful evaluation to ensure safety. Ipecac and apomorphine are usually used as emetic drugs. Second is gastric lavage. The gastric lavage procedure involves inserting a tube into the stomach and flushing it with water or saline solution to remove ingested poisons. It is usually reserved for cases involving large ingestions or when emesis is contraindicated. Here I have by mistake mentioned the lavage tube size in chemical adsorption, but it is a part of gastric lavage. So lavage tube for adult, it is 36 French tube used, and for child it is 24 French tube. It is a number of tube by which we can which is used in adult and child for gastric lavage purposes. So the third is chemical adsorption. In this we may use activated charcoal. We all know charcoal is used as or work as a adsorbent. So activated charcoal is highly porous substance that can adsorb various toxins in the gastrointestinal tract, reducing their absorption into the bloodstream. Activated charcoal is work on surface phenomenon. That means it may stick the poison particle or chemical particles on its surface. Fourth one is chemical inactivation, in which we may use antidotes. This involves administering antidotes that chemically alter the poison, making it less toxic or preventing its absorption. For example, formaldehyde poisoning can be treated with ammonia to form hexamethylene tetramine. Fifth one is purgation. The rationale for using an osmotic cathartic is to minimize absorption by hastening the passage of the toxicant through the GIT. Example is sorbitol, which is most effective in purgation cases. Last one is enhanced elimination of poisons. We may enhance elimination of any poison by using these processes. First one is biotransformation. Second is urinary excretion. Third one is biliary excretion. And last one is dialysis. So that's all for today's lecture. Thank you, students.